Vermont EMS Vaccine Administration Training and Guidelines Pediatric Refresher. This training serves as a refresher for the administration of pediatric vaccinations. Learning objectives for this training include positioning of infants, children, and adolescents, choosing the correct needle length and size, and review of pediatric IM injection sites and injection techniques. Parents and caregivers play an important role when children receive vaccines. A parent's embrace during vaccination offers several benefits. A comforting hold safely prevents children from moving arms and legs during injections, avoids frightening children by embracing them rather than overpowering them, encourages parents to nurture and comfort their child, and allows a healthcare professional steady control of the limb and the injection site. For infants and toddlers getting a shot in the leg, the parent or caregiver can hold the child on their lap, place the child's arm under their armpit and apply gentle pressure with their upper arm for a secure hug-like hold. Use their lower arm and hand to hold the child's other arm gently but securely, and anchor the child's feet firmly between their thighs or hold securely with their other hand. For older children getting a shot in the arm, the parent or caregiver may hold the child on their lap or have the child stand in front of them while they sit. Embrace the child during the process. Anchor both of the child's legs between their thighs. The following video gives more detail on positioning pediatric patients for IM vaccination.
In this video, I will demonstrate comfort and restraint techniques for infants younger than 12 months of age. Immunizations are vital for the health and well-being of children, but getting a vaccine can be stressful for both infants and parents. Including parents or other caregivers when administering vaccines increases the comfort level of an infant during vaccination. It is important for the safety of the infant and person administering the vaccine that the infant does not move during an injection. The person administering the vaccine needs complete access to the limb. Instruct the parent or adult who brought the infant to sit and hold the infant in either a chair without arms or on an exam table. The vaccine administration site needs to be clearly visible. Have the parent hold the infant on their lap. The infant should be turned to the side. Tuck the infant's arm between the infant's and the parent's body. Then put the parent's arm around the infant, holding the infant's outer arm. Put the parent's other hand on the infant's leg near the parent's thigh. If the parent or adult is uncomfortable holding the infant, have another person hold the infant. In this section of the video, I will demonstrate comfort and restraint techniques for children 12 months through 35 months of age. Have the parent hold the child on their lap with the child facing to the side. Move one of the child's arms under the parent's arm and behind the parent's back. Then put the parent's arm around the child and tell them to hold on to the child's other arm. The adult will now be holding both of the child's arms in place. Put both the child's legs between the parent's thighs. Put the parent's other hand on the child's leg near the parent's thigh. If the parent or adult is uncomfortable holding the child, have another person hold the child. In this section of the video, I will demonstrate comfort and restraint techniques for children 3 years of age and older. Have the adult hold the child on their lap with the child facing to the side. Move one of the child's arms under the parent's arm and behind the parent's back. Then place the adult's arm around the child onto the child's outer arm, holding both the child's arms in place. Put the child's legs between the parent's thighs. Place the parent's other hand on the child's legs near the parent's thigh. If the parent or adult is uncomfortable holding the child, have another person hold the child. This video is part of a series demonstrating vaccine administration skills and best practices. The series is available on the Vaccine Administration webpage on the CDC Vaccines and Immunization website at www.cdc.gov/vaccines.
Positioning adolescents and young adults. Studies have shown a high potential for fainting or syncope in this age group. Have the patient sit or lie down. Watch for symptoms that precede fainting, such as weakness, dizziness, and pallor. Provide supportive care if symptoms occur and observe for 15 minutes if possible. Choose the correct needle length and size. Vaccine must reach the desired tissue for the best immune response. Vaccines are not thick, so a fine gauge needle, 22 to 25 gauge, can be used. Choose the correct length by route, patient age, patient size or weight, and injection technique. Refer to this chart to select the appropriate needle length and administration site by age group in children. This slide shows the intramuscular IM injection site, the shaded area, for infants and toddlers. Insert the needle at a 90-degree angle into the anterior lateral thigh muscle. This slide shows the intramuscular IM injection site, shaded area, for children and adults. Insert the needle at a 90-degree angle into the central and thickest portion of the deltoid muscle, above the level of the armpit and approximately 2 to 3 finger breadths below the acromion process. The following videos explain pediatric IM injection sites and IM injection techniques in more detail.
In this video, I will identify intramuscular injection sites. This route is abbreviated IM. Before administering any vaccine, always start with proper hand hygiene. CDC has hand hygiene guidelines and resources for healthcare personnel available online. An intramuscular injection deposits vaccine deep into the muscle tissue to allow for rapid absorption. The deltoid and vastus lateralis muscles are the recommended sites for administering vaccines by IM injection. For children birth through 2 years of age, the recommended injection site is the vastus lateralis muscle because of the relatively large muscle mass and the lack of major nerves and blood vessels. This muscle is located on the anterior or outer aspect of the thigh. Sometimes children need more than one vaccine during the same medical visit. The vastus lateralis muscle is preferred for administering multiple IM injections to this age group. To correctly identify the muscle, expose the child's leg. The entire thigh should be clearly visible. To find the injection site, place one hand across the top of the thigh and the other hand just above the knee. Give the IM injection in the area in between. Here's another way to find the vastus lateralis muscle. When a toddler or young child stands and their arm is relaxed and hanging down to their side, their middle finger dangles just over the vastus lateralis muscle. For persons 3 years of age and older, the deltoid muscle is the recommended site for IM injections. This muscle is located in the upper arm and is shaped like an upside-down triangle. If more than one vaccine is needed, the deltoid muscle can be used. To identify the site, have the patient seated with the upper arm completely exposed. Ask the patient to relax their arm. Shirts with tight-fitting sleeves that cannot be rolled up above the shoulder should be removed. Locate the acromion process or bony point in the shoulder. This marks the base of the upside-down triangle. The tip of the triangle is directly below the middle of the base at about the level of the armpit. The correct area to give an IM injection is in the center of the triangle, 1 to 2 inches or about 3 fingers width below the acromion process. Before administering any IM injection, check for lumps, swelling, redness, warmth, bruising, or wounds near the injection site. In this video, I will describe how to select the equipment needed to prepare a vaccine for an intramuscular injection for children birth through 18 years of age. This route is abbreviated IM. Steps include gathering necessary supplies and selecting an appropriate syringe and needle. CDC recommends providers prepare vaccines just prior to administration. Providers should prepare vaccines in a designated area that is not adjacent to any area where potentially contaminated items are placed. Before preparing or administering any vaccine, always start with proper hand hygiene. CDC has hand hygiene guidelines and resources for healthcare personnel available online. To begin preparation, gather the appropriate supplies. This includes a syringe and needle, pre-packaged sterile alcohol wipes, and bandages. A marker or label will be needed to identify the vaccine once it is in the syringe. A 1 or 3 milliliter syringe is used to administer an IM injection. Typically, vaccines are not a thick liquid, so a 22 to 25 gauge needle is used. The appropriate needle length can vary. A supply of needles in lengths appropriate for the patient population should be available. For an optimal immune response to occur, the vaccine must reach the desired tissue site. For an intramuscular injection, the tissue site is muscle. To reach the muscle, the correct needle length and gauge must be used. The vastus lateralis muscle on the anterolateral thigh is the preferred site for infants younger than 1 year of age. For the majority of infants, a 1-inch, 22 to 25 gauge needle is sufficient to penetrate the thigh muscle. For very young babies, those younger than 28 days old, and preterm infants, a 5/8 inch needle is usually adequate if the skin is stretched flat between the thumb and the forefinger and the needle is inserted at a 90-degree angle. The vastus lateralis muscle on the anterolateral thigh is the preferred site for toddlers 12 through 35 months of age. To penetrate the muscle, use a 22 to 25 gauge needle at least 1 inch long. The deltoid muscle in the upper arm can also be used if the muscle mass is adequate. A 5/8 inch needle is adequate only for the deltoid muscle and only if the skin is stretched flat between the thumb and forefinger and the needle is inserted at a 90-degree angle to the skin. The deltoid muscle in the upper arm is the preferred site for children 3 through 18 years of age. For most children in this age group, a 22 to 25 gauge, 5/8 to 1 inch needle is sufficient to penetrate the muscle. In general, older children and adolescents require a 1 inch needle. The vastus lateralis muscle is an alternate site if the deltoid muscle cannot be used. A 1 to 1 1/4 inch needle will be sufficient to reach muscle tissue in older children and adolescents. When preparing and administering vaccines, always follow safe injection practices and aseptic technique. Aseptic technique refers to the handling, preparing, and storing of medications and injection equipment and supplies to prevent microbial contamination. Always use a new needle and syringe for each injection. It is not necessary to change needles between preparing and drawing vaccine from a vial and injecting it into the patient unless the needle has been damaged or contaminated. Never combine vaccines in the same syringe unless specifically approved by the Food and Drug Administration, or FDA, and packaged for that specific purpose.
This concludes the Vermont EMS Vaccine Administration Training and Guidelines Pediatric Refresher. Thank you for your help as we work to protect our communities from infectious disease and vaccinate the pediatric population.